If you are a clinician who works in any kind of inpatient setting, so acute care hospital, inpatient rehab, skilled nursing facility, long-term care, you're unfortunately going to be working with a patient here and there who has developed a pressure wound. So, especially if you're the clinician who is caring for the wound or has any involvement in that way, it's going to be cringeworthy every time that this happens. The main reason why is that for any and all reasons, this should be preventable. The wound itself is caused by pressure. So, you would think that, if we just reposition people, pay attention to little things like that, that we shouldn't have pressure ulcers at all. But they are unfortunately a little bit more common than you would think. And the reason for that, or one of the reasons for that, is because they form a lot faster than somebody would think. So we may think, oh, they're okay, they've been sitting there for a couple of hours, or, they haven't been out of bed for that long, or they've not been in bed for that long, but in fact, that's actually one of the myths that Michelle busts in our wound care course, is that pressure ulcers can actually form a lot quicker than we all really think. So if we're not putting some things in place to prevent them, we're unfortunately going to come across them all the time. And then we have a whole snowball effect of other problems. If they're in a facility for rehab, it's going to impact that. It's going to impact their overall health, their overall outcomes, their ability to function in their homes, things like that. So, the best thing that we could do in this situation is be proactive and pay attention to how they're positioned and what kinds of pressure are on those high-risk areas. And you might think, well, yeah, obviously, we want to try to prevent them. That's why it's so frustrating when it happens. But remember, they happen a lot quicker than one would think. So, the best thing to do is to get the whole team involved. So you don't want to just take this on yourself if you're the wound care clinician. You want to get the whole team involved. That way everybody knows what is expected of their positioning, what kind of devices they need. So you really want to take a look at, where do they spend the most time? Are they in bed most of the time? Are they out of bed most of the time? Is it a combination of both? And do they need any kind of special devices for any of those areas? Their wheelchair, the hospital bed, do they need pressure reducing types of mattresses or cushions? And then also even just simple things like making sure their heels are elevated when they're in bed. That any kind of medical devices they might have, if they have oxygen, and that the oxygen tubing around their ear is padded. And you want to do all of these things before you notice a problem. The main thing about pressure ulcers is getting ahead of them, putting things in place so that pressure doesn't occur to begin with. So like I said, medical devices like oxygen tubing, or even like a Foley catheter tube that might be laying over somebody's leg, over the course of time, might also cause pressure. Or in the ICU, there's all kinds of different things that can be attached to a person that you would want to pay attention to. So really providing that extra padding and extra attention, repositioning, don't leave it in one position for too long. And like I said, get ahead of it before you notice that redness, before you notice the problem. And I think that's where most of us are faltering. A lot of things that we do are mostly reactive instead of being proactive. So we wait until we see that red, non-blanchable area before we're like, oh, there's a problem here. There's a lot of pressure building up. Or, God forbid, it gets beyond that stage 1, and then we're really dealing with a whole other situation. So you want to get anybody that's involved in their team to give their input. Everybody has a different level of expertise and knowledge when it comes to all of this stuff. So you want to, make sure you're getting input from the nurse, the therapist, the CNAs, the physicians, everybody, the dietitian, make sure that they have everything to prevent this from happening in place. So that's what I have to tell you today. So it may seem a little bit, obvious, but it's something that, unfortunately, like I said, we're not always paying attention to before it happens, in order to prevent something that can really, really be very, very preventable.